live now.
Good morning. Today's topic is liver testing. It is somehow in the minds of the public, and then unfortunately doctors. It has been put that the liver testing is done by blood test, and that is all business gimmick. So you go to parks, you go to places where there is public, the leaflets are being distributed. You want to test your liver? The man will come collect your blood. They will give you 15-20 tests. That is your liver testing. That is wrong, absolutely wrong. Liver testing is by number one, talking to the patient, history taking, then general examination, top to bottom, and then local examination of the liver, spleen, veins. Unfortunately, the public has been fooled by, for example, cardiac profile. If you want to test your heart, then you do a cardiac profile where there is total cholesterol, triglycerides, which has nothing to do with the heart actually. Then LDL cholesterol, HDL cholesterol, apolipoproteins, A, B. In my opinion, all the tests worth 1,000 rupees is rubbish. Yes, you want to see the heart position of a person, spend some time on the history. What did his father die of? What age did he die? 55? What did he die of? Heart? That's very important. What did the mother die of? How many brothers he has got? Is any brother? Oh, one brother had a stent put at the age of 60. Then what about his uncles? Paternal uncles, maternal uncles. Maternal uncle, oh, one maternal uncle had a bypass surgery done. You spend so much time, but you got the full history of his heart. How much is he prone to get a heart? And now that if he is a smoker, drunkard, overweight, not doing exercise, finish. Similarly, liver. Liver is not tested by LFT, for example. The liver profile is liver function tests. Liver function tests are not liver function tests. They are not liver function tests. There are hardly one or two tests which are testing the liver function. Most of those tests are not function of the liver. They are giving you information that the liver is damaged. That's all. So how do you find out? You take a history, very important. When you take a history, if the patient is taking drugs which are causing injury to the liver, that injury will be picked up by liver function tests, not the function of the liver. For example, tuberculous drugs are notorious for injuring the liver. Isoniazid and rifampicin, which are the two best drugs for tuberculosis. So every time I prescribe isoniazid, rifampicin, the patient has to come back to me after 6 weeks. The treatment is for 6 months or 1 year. But after 6 weeks, he has to report and show me SGPT report. If the SGPT is normal, continue the drugs. If SGPT is raised, we have to stop the drugs. Then, of course, everybody knows what alcohol is then injurious to the liver. NSAID also are known. Paracetamol. It is said that the paracetamol is the only allopathic drug which has got no side effects. But I want to stress on this point. There is no allopathic drug which has got no side effects. Sorry. This is like once you decide that you are going to ride a motorcycle, you have to be ready for side effects. Put on a helmet, put on this. Why? Because you can fall down anytime, you can die anytime. So this is our drugs are like this. Even paracetamol. If you take in a dose of more than 10 grams, normally the dose of paracetamol is about 1 to 2 grams per day. Now 6.5 650 milligram tablet also, if you take 3 times a day, it comes to about 2 grams per day. But if you take paracetamol in a dose of more than 10 grams, when I used to take whole night classes in my Grand Medical College, so whole night to sit from 9 at night till 5 a.m., it is not possible. You are going to feel sleepy. So they'll start dozing. So I had to give them a lot of jokes. Every half an hour, 1 hour, I have to shake them. Something to shake them so that they don't feel sleepy. And this was one of the methods to shake them up. So I'll tell them that any of you are fed up of life, you're fed up of this medicine, this, that, commit suicide. So how will you commit suicide? Take a rope, hang from the fan and all. No. That is for poor people and illiterate people. Fashionable method of committing suicide, paracetamol. Take 2 pegs of whiskey and then take 20 tablets of paracetamol, which is 10 grams. Next day you will not be there. Finish. So liver, it finishes the liver completely. In one night it is gone. So even paracetamol can be hepatotoxic, but not in the doses which we use. Antibiotics which they use in the hospitals. Fortunately, antibiotics which you use in your private practice are not so hepatotoxic. All psychiatric drugs of epilepsy, in the long term they can injure the liver. And this herbal medication is notorious. Many herbs can cause liver damage. And there are some drugs which contain herbal medicine. They are not herbal, but one of the components is also herbal. So you have to go through all those tablets which the patient is taking. And then of course viruses and common fevers can affect the liver. Any common malaria, dengue, flu, they can affect the liver slightly, nothing else. Most important injurious to the liver is the junk food. Junk food causes fatty liver disease. FLD is what? Fatty liver disease. SH is what? Steatohepatitis. Hepatitis. And non-alcoholic means people who don't drink. And today these illnesses are becoming more than alcoholic liver disease. We don't see alcoholic liver disease so much as this. And all this junk food damages because of this trans fatty acids. You see, all the junk food, if you notice, the oil in which you cook, that oil is used again and again and again. And what is again left over today is used tomorrow. What is left over tomorrow is used day after. That produces trans fatty acids. They are very bad. So best thing is to advise everybody. Don't eat out, don't drink out, no soft drinks. Because trans fatty acids, salt and sugar, these 3 are your enemies. Best thing is, take a breakfast in the house, 7 o'clock, 8 o'clock, whatever you want. All foods are good, there is nothing bad. And then come and take lunch at 1 o'clock. And then at 8 o'clock at night, take dinner. Don't eat out, no junk food. Your liver will be very good. At home they can use oil, ghee, anything. You see, in the house no woman will use the same oil again and again. No. Whatever is used today, no trans fatty acids. So, when we do liver function tests, although they give you 12, 15 liver function, there are only 3 liver tests which are important. Only 3, SGPT, bilirubin, serum alkaline phosphatase. Now out of these 3 again, bilirubin is to see jaundice. Has he developed jaundice? And what is the level of jaundice? Serum alkaline phosphatase. Really speaking, it is not a liver test, it is bone. It comes from the bone and the age. You will be surprised. 1970, Jaslok Hospital. The owner of the Jaslok Hospital, his son, 12 years old, got beautiful marks and he gave a party, this and that. Then he sent him a health checkup. Alkaline phosphatase was very high, 150. All other tests were normal. So he sent them to the gastroenterologist and nobody could spot it. Why? What is it from? Why is it coming from? He happened to meet me in a lobby and he used to offer me beer whenever I went to his house, a glass of beer, and of course he was fond of whiskey. So he said, "Hey Opie, my son has got some liver problem and they can't sort out. What is it? This alkaline phosphatase is 150. I said, very good. What happened? Normal. Normal? He's 12 years old. Once you're an adolescent, you're growing. As long as you go on growing, from the bones, you get alkaline phosphatase. Very important. Old man comes to you, more than 60 years old, pain here, there. Remember that cancer of the prostate is the commonest cancer at that age. And the secondaries from the cancer go in the bones. X-ray cannot detect. But alkaline phosphatase goes up. So the point here is that these people are giving you the reading of serum alkaline phosphatase, but you don't know whether it's coming from the bones or from the liver. So really you are supposed to do liver fraction, they got it. Bone fraction and liver fraction. Nobody does it. Don't ask me why. Nobody does it. So we want to make sure that this alkaline phosphatase, if it is high, it is from the liver. So we have to spend extra money on the patient, get gamma GT test. So gamma GT, if gamma GT is high, that alkaline phosphatase is from the liver. If it is normal and alkaline phosphatase is very high, then look for the bones. Very interesting test. When the Arabs came to Bombay, people, all doctors are making a lot of money. And so many Arabs were diagnosed as drunkards because the gamma GT was high and otherwise there was no other virus test, etc. And they were told they got liver disease, kabid they call it in Arabic, kabid, muzin. Poor fellows used to become nervous. They would land up with O.P. Kapoor's clinic. And I'll say, what's the problem? Gamma GT, kabid, khalas. Then I'll ask them, the previous day when you went for test, did you have that bottle of beer? We used to have big bottle those days, 1970. Yes. Yeah. So it is due to that beer bottle which has caused gamma GT go high. Very interesting. Once you take a bottle of beer, big bottle of beer, and next morning you get gamma GT really high. After 2 days, normal. I do take the help of this test sometimes in alcoholic patients who are telling me lies. That they don't drink much, If gamma GT is high, he must be drinking more. But otherwise it has got no value. Value is only to find out, is this test which is abnormal, you want to diagnose liver, is it coming from liver? So we are left with only 3 tests. Bilirubin is only to see level of jaundice, level. Is it 5, 10, 15? And the doctors get very, moment it is 10, 8, oh, patient is going to die, viral hepatitis. No, he is going to die, you will come to know how serious is he from SGPT. Even SGPT, in viral hepatitis, SGPT is very high, in hundreds and thousands. But otherwise, if you want to do one test to see your liver has got any injury, anything, SGPT is the only test, one test. But otherwise, 3 tests. Now, if you are a veterinary surgeon and an owl is brought to you, so you can see jaundice 1 second. Why? Because the sclera bulbar conjunctiva can be seen above and below the pupils. In human beings, it's not like this. The jaundice, fortunately, the pigment gets deposited here, above and below. It is not in the front. This gentleman, Kerala fellow, Malayalam boy, man. And in Jaslok Hospital, we had a nephrologist. The first nephrologist in Bombay, top fellow, Mani, Dr. Mani, top, very intelligent guy. One day in Jaslok, I was entering the hospital. He said, OP, I'm sending you my servant. And that bloody fellow doesn't want to work. Today he'll say this, I've got pain, I've got this, no hepatitis. Last 1 week he has not worked. Check him up, please. I said, good. I looked at it. Unfortunately, he couldn't speak Hindi. So I asked him, Yangide Undu, in Malayalam, Yangide Undu, how are you? Sugam? No. He started talking, that. So I told him, look down and raise this. He had jaundice. See, jaundice has to be seen by doing this test because it is in the periphery. It is not around the cornea. So when he was looking straight, you can't see. But moment you can see, or if you want to see the lower part of the, see here, you push it down. So jaundice has to be seen, and it's a very important sign in an unconscious patient. Somebody brings you an unconscious patient, nobody with him, no history available, whether he was knocked down by a taxi or whether he has got cerebral malaria, whether he has TB meningitis, cerebral hemorrhage. You have to decide and send him to the specialist. Don't forget to see the eyes in the unconscious patient. Unconscious patient going into coma, the viral hepatitis. We had this doctor in JJ hospital and anesthetist. He developed this viral hepatitis. The third day he was normal, but he became slightly drowsy. And they rang me up. I said, dangerous. So I said, send him to Jaslok hospital. We'll transfer. We've got more facilities there. AC perfusion, which is like hemodialysis of the kidney. You will not believe it. He was admitted next day. Deep coma. Third day, died. Viral hepatitis, acute hepatic necrosis, like fire. It's like a fire, Drugs can cause the same thing. So you must learn to see jaundice. And the clinical jaundice is only when the bilirubin goes to more than 3 milligram. Normally it's 1 milligram. So people who have got 1.5, 2.5, 2, 3, you can't, there is no jaundice seen in the eyes. So by the time you see jaundice, the patient already has got 5 or 6 or 8 milligram bilirubin. Nothing to get frightened. So all these bilirubins which are less than 3, which are abnormal, you will find in non-hepatic patients, in the sense that surgical wards, gynec wards, injury wards, ICU, patient having a lot of drugs, etc. One of the drugs will raise bilirubin and no jaundice will be seen. And this, as soon as the patient recovers, antibiotics stopped, everything stopped, bilirubin also comes down to normal. They have all got liver damage, but temporary liver damage, not due to any virus. So, if you are lazy or you don't want to wait for a liver test report which will come next day or in the evening, tell the patient to give the urine. And then you pass urine in this, and this is patient urine. Your urine is normal. Then you find this urine is dark. And then dark, and it is transparent. It's not opaque. You see this shadow there. I mean, you can see through it little bit. We call it transparent. Because there is other urine also, which is dark but black, but it's not transparent. It's opaque. Opaque. This is hemoglobinuria. Every doctor must know this. That if any patient of yours, anytime, anywhere, passes suddenly black urine, he's got hemoglobinuria. That means he's got G6PD deficiency. G6PD is an enzyme which, if not present in the body, deficient you are, then lot of drugs which you give, sulfa, these anti-malarial drugs, etc., can cause hemolysis. And you give the drug, the whole RBC is hemolyzed, and the patient becomes pale. Hemoglobin drops suddenly and he passes black urine. You have to diagnose it. Abroad, G6PD is written on everybody's identity card. Abroad, G6PD. In our country, it's not so much also, and not only that, in our country, though, when we see G6PD deficiency, the virus of viral hepatitis can cause hemolysis. The virus of viral hepatitis. That means patient is already jaundice. You are treating viral hepatitis patient. And suddenly he is improving. Next day you go third, he becomes weak, very weak, and looks pale. The tongue is pale, conjunctiva is pale, the palms are pale, nails are pale. And you say urine, what about urine? This is the urine, this is the urine. He is hemolyzed due to the virus, not drugs. But anyhow, you have to start treating, otherwise the kidney failure can take place. So, in viral hepatitis, which is the commonest disease in private practice, general practice, commonest liver disease, very, very common, extremely common in India. Children, grown-up people, and all. Of course, if it is a pregnant woman, and especially the last 3 months, if she develops viral hepatitis, dangerous, huh? 10-20% chance she is going to die. Don't touch her, send her to the hospital. Otherwise, viral hepatitis, nobody dies. 0.1% death. Although the liver is completely necrosed, but the recovery, the liver has got this strong point. It recovers very fast, very fast. How are we doing liver transplant? You're cutting this much liver and giving it to your son, and this much is left with you. I realized this years back in my early practice, when I was hardly 40 years old, and I had this patient who, in the left lobe, those days we used to, there was no investigations, etc. We would palpate, diagnose. In the left lobe, he had a big tumor. I diagnosed it as a cancer of the liver, and I told the surgeon to cut the left lobe. Very good surgeon. He removed the left lobe. Patient was cured. After 3 years, this patient came to me for something else. And I remember we had removed his left lobe. And when I was examining him, he had a left lobe. By the time sonography had come, he had a full liver. The liver grows. You can't believe it. So, the alcoholics have to be told this. If you can only stop, the liver can come back to normal. That's the beauty of the liver. This patient in the viral hepatitis, all the liver cells are dead. Finish. It is like a tree which was full of flowers and leaves, and one day you see it, the only stems, branches. Oh, the tree is dead, it should be removed. No, wait for the next season. The next season, the same tree will be full of beautiful leaves and flowers and all that. That is viral hepatitis. if a jaundice patient passes a whitish stool, remember that he has got some obstruction, either due to viral hepatitis or something else. The jaundice stool should be more colored, not less colored. And urine, I told you, if it is absolutely black, that is hemolytic jaundice, anemia will be there, and then you will find the bilirubin will be unconjugated. The unconjugated, there is nothing like in liver unconjugated. Liver bilirubin is always conjugated. This is the only thing where you find unconjugated. So, liver function test, as I told you, they are not really liver function test. They are injury to the liver. The power of your liver is done by those tests which I will discuss later on. Only two tests, only two, to find out how strong is your liver. One is albumin, serum albumin. The second is prothrombin time. So all these profiles they do of the full health chapter. Nobody does prothrombin time. So half is gone, and then comes serum albumin. Serum albumin, though you go to the wards, surgical wards, obstetric wards, ICCU, so many patients, the albumin is normal 4 grams, it's less than 4. Because of sepsis, this, that. The half-life of albumin is 2 weeks. Which means after 2 weeks the liver has to give another albumin and the level comes up. So you find all these patients who have got this low albumin, within 2 weeks it becomes normal. But if you find a low albumin in alcoholic patient who is drinking 2, 3, 4 pack, he says he drinks little, otherwise he is normal, and you find his albumin is low, less than 4 grams, his liver is going. He is losing his liver. Of course, I don't believe in this single report of this less than 4 grams from one laboratory. How do I know it's a correct report or a wrong report? I'll get it again, second laboratory. Because it's a lifetime position. That liver is not going to come back. That he has developed cirrhosis. So, if you say liver functions, sorry, we are not testing liver function. If you want liver function, serum albumin, prothrombin time. Prothrombin, because of prothrombin time, when you bleed, you cut some, bleeding stops after 2, 3. How? So all this prothrombin time is depends on liver factors. Factor 5, factor 7, factor 11, factor 12, we are taught in the medical college. Where are these factors coming from? Liver. All the factors are in the liver. So, if your liver starts deteriorating, prothrombin time will increase. Sometimes in a viral hepatitis patient, 16-year-old boy going to the college and one son only, and the parents want to know, doctor, he is not serious, no? He will not die, no? Bilirubin 8, 10 milligram. Clinical judgment, he has no signs of liver failure, hepatic coma. And if you want to confirm in the blood, prothrombin time normally is 12 seconds. If prothrombin time in that patient turns out to be 1 minute, 60 seconds, 60, most likely that patient will not survive viral hepatitis. So of course you have to make sure patient is not taking anticoagulants. When we give anticoagulants for the brain illnesses, prothrombin time increases. We want to increase prothrombin time. So these are the tests which show us some injury to the liver, and you have to find out from history again what drugs is he taking, how much alcohol he is taking, etc. The doctors have a very wrong approach, negative approach. Most of the GPs also, negative approach. I don't understand it. It's a wrong approach. The patient, when he comes to you, he should go smiling, laughing. Your patient go when they leave, because the patient was, now this Mary Fernandez, this patient was there, and very intelligent lady, 45 years old, menopausal, but working in a big office and very intelligent, and guanis and also twice a week, little alcohol, twice a week. You know, the whole office is sent for health checkup. The big companies are doing that. From where are they making money, these pathologists? From all. So massive health. They find out SGOT instead of 40 is 49. Finished. Now he goes to the GP. The GP will see, oh, SGOT is raised. Mrs. Fernandez, how much do you drink wine? No, doctor, wine I take twice a week, in Goa we all take. No, your liver is damaged. Your liver is weak. And then little blood pressure also is, it should be slightly lower than this. So blood pressure also. So because if you blood pressure, you keep, then heart will get. The patient is so depressed. When she goes, after seeing one of the doctor, then she'll say, see O.P. Kapoor. She'll come, O.P. Kapoor. She'll come, yes, Mary Fernandez. How old are you? 45. 45. Oh, really? You look young. You look like hardly 30. No, doctor, I'm 45. So what's the problem? No, this SGOT. What is SGOT? It's normal, no? When the doctor says, forget it, it's a normal liver. You take wine twice a week, start 3 times a week. Because your liver is strong. And then I examine, your heart is very strong, your blood pressure is very good. All you need is to start walking half an hour, 1 hour per day. That's all. And I'm giving you this tablet. I give to every patient who enters my clinic. Zental, that's for the worms. I told you when we discussed that lecture. So I'm giving you this one tablet only. If any worms, big, small, which you can't see, will be passed, finished, you are going to live 90. Mary, and put your hand on her shoulder, go and enjoy. This Mary, she's slightly dark, Gawani is slightly dark. She goes in a big mood, next day she starts putting more powder on the face. So the glow should come on the face. After 2-3 days, her some friend made, Mary, you're looking very bright. Face looks white. She said, O.P. Kapoor, go and see them. And his dress and his bow tie and all, very good doctor. This is how the publicity goes. By what? Positive approach. This is positive approach. This is such a bad world, you don't know whether tomorrow you will be alive or not. Why do you want to make her miserable? And make yourself also miserable. Then you'll worry about her pressure, liver, and then get heart attack early. Doctors get heart attacks. Wrong. You have to have positive approach. Liver function tests and nothing, rubbish. Here and there, something abnormal. So it's an injury and not a function which you're testing. Remember that. And SGPT is the most important single test, SGPT. Normally up to 40, in different laboratories, different readings, around 40. But in viral hepatitis, which is the commonest liver disease, which you see in fever, loss of appetite, it rises to more than 10 to 100 times. 10 will make 400, 100 will make 4,000. Right? Even if it is 6 times, let's say 250, 300, even then, that is viral hepatitis. SGOT, long old test. It was my thesis, MD thesis, 1955. I did SCOT. And then I wrote this paper that myocardial infarction and SCOT is increased. I was testing on heart and it was high. Later on people testing liver. So many illnesses SCOT increases. Yes, in alcoholic patients SCOT increases more than SGPT. It's not really important. In alcoholic patient, if you want to see he is real alcoholic, ferritin, iron level. Once you are a drunkard, your face becomes red. So all these film actors, you see their first movies, Rajesh Khanna, earliest movie. And you see, and as they grow, you see they becoming red, ferritin, iron level in the blood go high. So gamma GT I told you, serum alkaline phosphatase. But if serum alkaline phosphatase is very high and bilirubin is not very high, then patient has got some cholestasis. Cholestasis means what? Traffic jam for bilirubin. Bilirubin, there is a traffic jam. It is blocking. Something is being blocked, either in the liver, outside the liver. In the liver, it could be even viral hepatitis. Or so often viral hepatitis patient, after 1 week or 10 days, they're improving, they're good appetite, everything. But doctor is scratching, itching. Then you ask them, how was your stool yesterday? How was the color? A little lighter. That is cholestasis. Temporary cholestasis. After a week, it will clear up. But if it is due to gallstone in the common bile duct, cholestasis, cancer of the biliary tract. So that's the value of alkaline phosphatase. Number 2, space occupying lesion. If there is some lesion in the liver, so whether this is a tuberculosis, tuberculoma, cancer, some fungus, whatever, anything, secondary deposit, alkaline phosphatase will rise. You have to know about the viruses. If you want to learn liver, you have to, and viruses is not very difficult. They were a little easy, but to make them difficult, which viruses? A, B, C, D, E, F. I put F also. F is not a virus. F means junk food. Junk food is more important, damaging to the liver than all these viruses. So A, B, C, D. So in that the D virus is related to B. So we can forget about it. So you're left with only A, B, C, E. In children, hepatitis virus which attacks them is viral A. So up to the age of 25, 30, when you get jaundice, viral hepatitis attack, it is viral A which causes jaundice. Viral A is seen in the blood in the form of blood test of hepatitis A-V, HAV, hepatitis A virus, IgM. IgM means fresh. If you ask for IgG, it will show you that he had jaundice maybe 10 years back or 5 years back. So IgM is fresh. But adults don't get viral A hepatitis, they get viral E hepatitis. Hepatitis, the test will be hepatitis E virus HEV IgM. So these two tests will tell you is it A or E. If you want to save the money, adult you ask for this test. If it is negative, then you ask for this test. Viral B hepatitis in jaundice and all, very rare in private practice, very rare. But the presence of viral B in the blood, there are thousands, lakhs, million people in the world who have got the virus B in the blood. Virus B in the blood, we don't see the virus, we see the antigen. So we call it hepatitis B surface antigen. Why S? Because this antigen has got surface or the core. Core means inside the body. Two types of tests you can do. And if you find this hepatitis B surface antigen present, that patient has got viral B disease. No, you will not see it during jaundice. It's not common. You can see it. And when it produces hepatitis, the HBsAg in majority of them, 90, 95, 96, 97%, it disappears. Finish. If you do the blood test, it is negative. Then how will you know it was hepatitis B jaundice? You do this test. Core antigen, hepatitis B, HB, C, IgM. That will be positive in 100%. That means this jaundice is due to hepatitis B. Much less common. Much less common. But this particular thing we are going to discuss later on. It's a different thing altogether. So, chronic illnesses are from C and B. C comes from the blood transfusion. Anytime, even on the highways, this, that, you accident, you want to take a blood transfusion is one of the most dangerous things, because it is full of viruses. This virus, that virus, HIV virus. Today, when you want to be given, you want to take a blood transfusion, the test to see the blood which is being given to you, that has it got any disease, that costs some 5,000 rupees. Much more than the blood itself. We don't want to give it your disease. So, while hepatitis B is present. Sex. You go and have sex with a woman, she has got hepatitis B, you will get hepatitis B through the sex. Intravenous drugs, drug addicts, very common. Hepatitis B. Piercings. All these women go for piercing here, piercing there, and all that. The men will go for tattoo. You see, this very funny, this B virus. You just touch it and you get it. You touch it and you get it. If you are carrying this virus, for example, at home, all these rich people, they go out to work. So at home only cook and the servant to clean. And this servant goes, then he goes to the bathroom to clean. Then he sees his boss's toothbrush. Now this poor fellow has never done toothbrush. So he will take that toothbrush, and how will the boss come to know that he has cleaned? Now when the boss comes and uses the same toothbrush, if he has got hepatitis B, boss will get hepatitis B. Very easy. The children, when they are playing with each other, they can transfer hepatitis B. So it is bad virus. Why? Because we don't have good drugs to treat. And as I discussed just now in a few minutes, that if you are carrying this virus, you are like a leper in modern days. You got a very good job in Dubai, you want to go there, they find HBsAg positive, finish, get out. They don't keep you there. You want to go to America, you got HBsAg positive. This is like when you remember I showed you that X-ray of calcification, calcified shadows, old tuberculosis. But handicap like this, it's a very big handicap. You want to get married and they come to know that you got HBsAg, so go to doctor, get the certificate, this and that. And if this patient who has got HBs antigen, hepatitis B, if he has got HBe antigen also, E is a daughter of S. Very bad, very bad. If E is negative, good, at least his liver will not get damaged in his lifetime. And when you recover from B, you will develop antibodies which are known as anti-hepatitis B surface antibodies, anti-HBs antibody. Now even public knows this. Doctors have to know all this. Public, you know, corona and all that. You've taken 2 vaccines. Should you take another one after 6 months and all? Show us the report of antibodies against corona. So same thing here. You are showing antibodies against hepatitis B. If they are there, very good. If they are not there, give vaccine. So, that is the anti-HBS. Anti-HBE, if you have positive, that means antibodies against hepatitis B, E, very good, because E is dangerous. He is a danger. That girl, that granddaughter of that surface antigen is very dangerous. It goes and his liver cannot be, badly damaged. While if it is positive, then you have to do other tests like a viral load. In the end, if you can produce anti-HBS surface bodies, you will be a very happy man that you have treated the patient. So, activity of a liver is by SGPT. But if an alcoholic patient wants to know, has he got liver disease, then sonography is not enough. Sonography is very good for space occupying lesions. You got a big tumor there, secondary deposit. But if you want to do alcoholic liver, you want to, how good has he developed fatty liver, has he developed cirrhosis, and what is the stage? Fibroelastography. And if he does it with Doppler and puts contrast, this report can be matching MRI report of the liver. So this might cost you 5,000 rupees, 6,000, but the MRI will cost you 12,000. So normally for these are used for space occupying lesions. Is it cancer? So fibroelastography has turned out to be a very beautiful test for the liver, in the sense that, like you do these bone studies, densometry. So, to see osteoporosis, we have discussed this earlier. So, when they give the reports, they give the figures, -1, -1.5, -2, -2.5, -3. Moment it's more than -2.5, -2. That patient needs treatment for osteoporosis. So, similarly, here you get those figures, So, from those figures you can make out, is the liver deteriorating or improving? If that liver, it can improve. Raj Kapoor, the very big drunkard, no question of that. He didn't develop liver disease. Why? You know why? Because once his picture got over in 1 year, he'll do editing himself. He had no editor. He had his own theatre. In the theatre in the corner, there was a room for editing. He used to go to the room, and for 1 month to 2 months, he will not come out. Editing, no going home, no drink, no nothing. Food will come outside in the tiffin. That means his liver used to get rest for 2 months in a year. That is how the liver picks up. The modern film actors, of course, now I have no film practice, but I am talking about 70s, 80s, then had a large film practice. But some of those old patients are still there. Now, like these Kapoor families, if they go on drinking, I tell them, do fibroelastography. If fibroelastography every year or two shows deterioration, stop drinking. Stop drinking for a month or two. Then again start drinking. That is how these people are living. That Ranbir Kapoor now is 70 years old and he is laughing, and the public dies usually by 70. I am still alive and I enjoy my drink. Why should I stop drinking? He is right, because he is in between, he stops, Moment fibroelastography report bad, 1 month he will not touch. And that liver improves. I told you, capacity of the liver to improve is unbelievable. If there is a history of blood transfusion, viral C is the most likely virus. You know, this blood transfusion could be 10 years back, 20 years back. I happened to see one patient who was from the suburb of Bombay, dhoti wala fellow, but he had 100 buffaloes, he had cows and all, a very rich guy. And he had an amputated leg. He was coming with an artificial leg. And he had developed ascites, liver disease. So he was going from doctor to doctor, then why did he develop liver disease? And I don't drink, he was not an alcoholic. He entered, I heard the story, I said, lie down. I said, let me see that leg. He said, no, my leg is amputated. I have come for this. This is my disease, not this. I told him, you know what, Baba? This is your disease. When this was operated, where was it? In some small nursing home 10, 12 years back. How many bottles of blood were given? 3 bottles of blood. This is virus C in the blood, which has now produced cirrhosis after 10 years. It could be after 20 years. Virus C is very peculiar. It comes. So if I get viral C at this age, I will not be worried, because who is going to live 10 years to get the disease? And for viral C, anti-HCV is a test, but not a reliable test, because this can disappear. So then you have to do PCR. Like in COVID also. And fortunately, you'll be surprised. Today, the modern drugs which have come, best drugs for viral C, very costly, a couple of lakhs, the whole course. But viral C is luckily very good treatment. But viral B, we are stuck up. So now this GPs, very often you get this. The patient comes, kya hai? Doctor Sahab, my liver is bad. Liver bad means what? He has got this in the blood. So he could not go to Dubai, he could not go to, he is grumbling. Or he is getting married and they are worried. They like the boy, very good boy, very good everything, but so they send to doctor. Do you think we can get the girl married? Yes. Why not? Why? I'll do some liver tests to see. His liver is already abnormal. Most of the time it's normal liver. But this virus is there in the blood. I'll do HBE to see. If there is no HBE, we will damage his liver later on. And anti-HBE is present, means that very good, I'm very happy. So I'll tell him to use a condom with his wife for 3 months. Do the HBsAg of his wife. If it is negative, vaccinate the wife. First, second injection 1 month, 6 months, third injection. After the second injection, he can remove the condom, no problem. So, this is how, when all these patients come to you, NAFLD, fatty liver, this, NAC, you can't do anything. You have to tell them stop eating the junk food, this, that. There is no very good drugs and all that. But you have to protect their liver. If they have got anti-HAV IgG negative, is normal. It should be positive. All of us should have anti-HAV IgG positive, because in childhood you must have got this in India. And if your IgG is negative, you need vaccine. Hepatitis A vaccine. Unfortunately, there is no vaccine for hepatitis E, which occurs in adults. No vaccine. Sorry. So you take vaccine 1, and after 6 months 2nd. Similarly, if you have anti-HBs is negative, you have no antibodies against hepatitis B at all, or very less than 1 in 10, then you take hepatitis B vaccine. Because if any of your patients who have got NAFLD, fatty liver, junk disease of liver, if he develops jaundice by this or this, he will be very severe jaundice. So he needs vaccine. There are 3 doses, one after 1 month, after 6 months. If as a doctor you're treating hepatitis B patient and by chance there is needle injury, you must take immediately hyperimmune gamma globulin. Spend money. Go here and there. It may not be available in your town. Go to the city immediately. Take this vaccine immediately. I mean, vaccine, it's a gamma globulin. Take that and then start the vaccination. Vaccination. 016. And this is the sorry. So we come to the next set. All these patients who drink every day, they come to you, doctor, you think I should continue drinking? I should stop drinking? Yeah, but I can't, So should I? So what will help to decide that he is developing alcoholic cirrhosis? Liver function tests don't help. If 100 people are drunkards, all 100 will not develop liver disease. Then 20, 30. Why? Acetaldehyde in the body. Those people who have got more acetaldehyde, they will not develop liver disease. They are lucky. They can drink more. So to continue alcohol, liver functions don't help. What will help is fibroelastography, which I was telling you. Then there is another type of patient who comes to you in the month of Ramadan or some fasting, and you suddenly find that, oh, jaundice, bilirubin 5, 6. So jaundice, immediately you get. But then when you see the jaundice, it is unconjugated. Unconjugated is not from liver. So this patient, unconjugated, like you get in hemolysis. I gave you an example of G6PD. But hemolysis, hemoglobin is normal. I mean low. RBC is low. Here normal hemoglobin, normal RBC. Unconjugated bilirubin, 3, 4, 6, 5. That's called Gilbert's disease. See, some people from birth, they have got some less enzyme. And they can have jaundice in the blood. Nothing wrong. No treatment, safe. Similarly, you can have conjugated bilirubin. But conjugated bilirubin means liver. It comes from liver only. But this patient has got normal SGPT, normal gamma T, normal alkaline phosphatase. And if conjugated is more common, again, if obstruction, alkaline phosphatase should go high. Moment they do fasting, the level goes up from 4 to 6. So in fasting, you should not get a health checkup done. It's misguiding. This is called as Dubin-Johnson. So this is, you don't have to remember the names and all that, but you can have bilirubin without any liver disease. And of course, if you got alkaline phosphatase markedly raised, then and no medical disease, investigate this patient thoroughly by doing a test called as MRCP. You can do ERCP, put a camera inside and go in the common bile duct and inject there. Well, 20,000 rupees, but lot of. This is very easy, simple. MR, nothing is done. They don't touch you also. Magnetic resonant cholecystopancreatography, retrograde. So MRCP is the test for MRI, where you can pick up all obstructions, complicated cases. So conjugated, unconjugated, and all these other causes, you don't touch them. As a GP, they were rare. They should be done by specialists only. And as I told you, very often you will see report of SGPT high and all that. Within 3 weeks you will find it gone. Some transient, something must have caused, some fever, some drug, etc. So the SGPT is such a single test important that when I took that lecture for bone disease, I told you rheumatoid arthritis is very common. GPs can diagnose easily and treat, no problem. What is your problem? And the best drug is methotrexate, once a week. This drug is a beautiful drug which you can give for 5 years, 10 years, 15 years. But this drug can cause liver injury. Can. So you have to tell them. that every 3 months SGPD to be done. You don't have to have liver profile or bilirubin, alkaline phosphatase, nothing, only SGPD. If SGPD rises, stop the drug. If it is normal, continue the drug. Any number of years, no problem. So the function, if you want to test the liver, there are only two tests. One is this albumin in the blood, and second is prothrombin time. There is no other method of testing that how strong is your liver. When the albumin goes down, of course for cancer, your alpha fetoprotein, beautiful test in the blood. If your blood test alpha, this is called a tumor marker. There are many tumor markers. You know, for example, for prostate, the commonest is PSA, prostatic surface antigen, blood PSA, and I like to do in all people more than 60, PSA test. But it's a useless test for prostate cancer. Why? If the patient had sex the previous night, PSA will be 500. If the patient went to a surgeon for examination for prostate the previous day, he has not told me, and the surgeon will put finger in the rectum and look for prostate. So the moment you touch the prostate, no, touch it, PSA shoots up. Next day I'll find PSA 200, 100. And if you have a mild infection, dhatu in the urine, mild infection, prostate, PSA shoots up. Therefore some countries have banned the PSA test, but many other countries are using it. I use it. There is no question of that. Because if you, as long as you know, but this is not like that. It's more specific, more helpful for diagnosing liver cancer. Now, the 1 year which I spent in the postmortem room with the dead bodies, what did I learn in the liver disease? I learned a lot. I learned a lot. Plus, I'll show you this, some of these pictures which I have taken in the normal people, normal who have died. How did they come to autopsy? How did they come to autopsy if they don't? They were medico-legal cases. In the autopsy room where we do autopsies, in the same room there are 2 tables that are kept for medico-legal, which is next door. Coroner sits there. So all the accident patients who die, all the poisoning patients who die, etc., they come to the coroner. So coroner has got those 2 tables separate. His doctors come and do autopsy. When I went to JJ Hospital for 1 year, this coroner, there was a Sindhi gentleman, he used to see me coming there, Mercedes car, chauffeur, I come out with my camera there, golden stethoscope, suit, bow tie. He used to see me daily. He was surprised that who is this? I mean, pathologists and all, they come in ordinary bush shirt, they're working. Then somebody told him, he is a physician, he is not a pathologist. O.P. Kapoor, he has taken leave, he comes to study here, autopsies. Oh. So when I went and introduced myself. Then I made friendship. Then next time I went, he offered me tea. Then I told him, Malkani Sahab, I want to request you something. I am studying for 1 year. Can I take the organs of your patients who come with accidents? Because it's not allowed, absolutely not allowed. First time he said no, sorry, not allowed. Second time he agreed. You can take organs of my patients, only you. So I started taking organs of patients who are healthy, who had accident and died. So I am studying there. So this is how I studied even liver there. You see, in liver what happens is when you get cirrhosis of the liver becomes nodular like this and becomes shrunken. Liver is a very big organ. It's the biggest. When you take out the liver, it's a big. In this case, this looks very big, this looks small. So this is, what is this? There is spleen. So in liver cirrhosis, the spleen enlarges. Due to what? Portal hypertension. Oh, hypertension. If you remember, in the past I told you, hypertension, systemic hypertension. This we call systemic hypertension. Hypertension in the brain, intracranial hypertension. There could be a tumor inside, remember that. So the headaches and all you have to look after. Similarly, when I took that class of X-ray, I told you about portal pulmonary hypertension. Hypertension in the pulmonary circuit, means pulmonary means lung. Dangerous, very dangerous. I won't like to treat this. These people die because now some new drugs have come. I'm not saying, but dangerous. Similarly, I told you venous hypertension or dependent edema of the pedal of the feet. At so much population, 10-15% population has got. You stand for a long time. This is due to venous hypertension. It's not dangerous. Today I'm going to tell you about portal hypertension. Hypertension in the portal venous tree. And in the portal vein, the spleen is the most important reservoir of the portal blood. So in portal hypertension, what happens? The spleen enlarges. And when it becomes big, so an alcoholic patient will either die of a liver disease, means liver coma, there is cancer of the liver, or this can kill. Before this kills, portal hypertension can kill you. And you will be surprised if at all there is clinical sign to diagnose this portal hypertension apart from spleen. Remember that. I am telling you, spleen, if the sonographer reports spleen is enlarged. In a normal person, Older days we used to say old malarial spleen. Now it's gone. No, it's number 2, not number 1. Number 1 is that he must be having cirrhosis. And the sonographer has missed cirrhosis in the sonography. Simple. So don't underestimate presence of spleen in sonography. And clinically, if you want to diagnose, all alcoholic patients should remove their clothes and stand like this. Stand like this. In standing position, if you see a vein like this, he's got portal hypertension. Similarly, simple, 100%. Portal hypertension. And what is the symptom of portal hypertension? No symptom. But when it produces symptom, what is the symptom? Piles. These are called as esophageal. I call them piles. Piles usually you get at the bottom. So what is the complaint? Some bottle, some stool, blood, that off and on for years together. These piles, esophageal piles, they don't trouble you. But when they trouble you, the first symptom is hematemesis, we call it, vomiting blood. Vomiting blood. And look at the amount of blood. So when we are doing autopsy, I had 4 to 5 MD pathology doctors who were doing MD pathology. They used to teach me pathology. I used to teach them medicine. We have to give the cause of death after the autopsy. So as soon as they'll see this blood, they'll say, sir, so cirrhosis of liver, death due to 1 bottle of blood was given. I said, no. Death not due to cirrhosis liver and hematemesis. Death due to 1 bottle of blood transfusion. Then they would, how can blood transfusion cause death? You don't understand. This patient should have got 4 to 5 bottles of blood. 1 bottle is peanuts for him. He'll die. That's how he has come here in the autopsy room. So when these people bleed half bucket full of blood, you have to have a blood bank which can give you 4, 5, 6 bottles immediately. The donors can come, you can give them. Oh, many of them will die. So you can have a death without any liver involvement. Liver had nothing to do with this, but poor fellow died. When the portal hypertension becomes more and the liver also starts failing, liver functions fall, this combination produces water. Big tummy, water inside. Even then patients sometimes, Shailendra, was a film writer those days. I'm talking about the 1970s and all that. Very good writer. Very good writer. Favorite of many producers, Raj Kapoor and all that. But he had to have in that trance he'll write, These people are, you see the wordings of the songs, they're geniuses. But poor fellow needed the help of whole day. He never went to a doctor. And when he developed dissension, he thought it is gas. Even then he didn't go. Only went into hepatic coma. O.P. Kapoor, I had to tell you at that time, I was very famous in the film industry. 1970s. We had no test. 1970s. We had no sonography, we had no MRI, no CT scan, no nothing. Even the blood test. He was admitted with coma, and then he vomited also blood. He died within 2 days. This is gone. Once you develop ascites, so can you diagnose liver albumin failure clinically? Low albumin, prothrombin time. Yes, you can. Edema of the legs. You don't know the clinical signs. I used to have a clinic in Fountain in Bombay, and my timings, I was always odd and all that. My first patient in the morning appointment 6:30. 6:30 in the morning. My whole staff used to be present, 9 people, and the first patient. But I had to. It was on the third floor, old building, means 6 floors. I had to have a lift to go. So the night chowkidar used to be ready to open the lift for me and take me up. Of course, I used to give 50 rupee note. Every morning, 50 rupee note. This fellow used to dress up very beautifully, bush shirt and all that. But chappal, always chappal. So one day he was taking me up and I saw his chappal. And I found edema of the legs. This straight, I told him the question. First question, kitna batli tum daru pita hai? Finish. He was shaken up. He was surprised. One bottle. Only one bottle. Country. Yes. अभी तुम मरने वाला है. ये जो पाँव में सोजन आया है. I turned his neck. There was no neck vein, so no cardiac failure. I said, वो पेशाब दे देना. I said, I'll check up the albumin in the urine. I knew it won't be there. He sent me urine immediately. I said, ये तुम्हारा liver खत्म हो गया है, खराब. अभी तो मरने वाला है. थोड़े महीने में तो मर जाएगा. दारू बंद करेगा, शायद बच जाएगा. Because liver has got capacity to regenerate. You will be surprised. I saw this liftman after 3 months, because there were a lot of liftmen. And he was no edema, nothing, absolutely. And he hugged me. He said, I've never drunk after that, after you told me. Never drunk. How much recovery of the liver? Yes, is there anything more for the prothrombin time? No. There is one more test which you people have no time to do, but very important. If you remove the clothes and around the chest and the shoulder, if you look at this swelling, that it is like a bloody arteriole, swollen, and see there are hundreds of branches of capillaries coming out. So it looks like a spider. We call it spider. So spider. And if you take a pin and put it in the center there, it branches, it becomes white. It becomes white. So this cannot occur in this. As you grow old, you develop these Morgagnin spots, we call them. Now these are present in the abdomen also, here and there, reddish. They look like them, only red. You put a pin there, they will not blanch. No. So this can indicate liver is failing. And then if you find bleeding the gums, don't take it lightly in an alcoholic patient and all that. Must be prothrombin time. Aye. So these are the only 2 methods in which you can. There was a time when I wanted to see the liver. Those days I'm talking about 65, 68, 19. So I told my friend Dr. Undre, just open up. We used to do what you call it mini laparotomy. Mini means you're just cutting to see the liver, nothing else, operating. So he cut it and he says, "Open now, see. You want to see the liver?" But soon after that, this laparoscopy came. With the result, you put a camera there through the small hole. Dr. Temtan Udwadia and some first doctor who brought this to India. So you you put this camera inside and then you move the camera. You can see the whole liver. Finished. So it has become so easy, the modern investigations. The liver is supposed to be vascular, not a very good slide to show you vessel, because it is an old thing. It had become few days old, and the liver abscess which killed him. But if you want to see the liver, this is called the liver. Look at the liver. Wow, solid. And look at the blood redness. It is red, full of blood. You see, you will be surprised. Liver is full of blood. Liver and spleen. These are the only two organs full of blood. So whenever you get accident, car injury, etc., if you are on the right side, go to a big hospital. Because if the liver is ruptured, you will need 4 to 5, 6 bottles of blood. Similarly, spleen on the left side, if spleen ruptures, of course, spleen can rupture without accident. Old malarial spleen, some illnesses, the spleen can rupture. Then you need 3, 4 bottles of blood. Anyhow, liver is a very vascular organ, so it should be like that, smooth, red, not nodular, not fibrous. In this patient, I took it from the Medical Eagle. He died of an accident, motorcar accident, motorcycle accident. This man had this swelling here. You see this swelling here, but somehow God has done this. In the autopsy, I would see, for example, lung. In the lung, it's like that. Small, balloon-like thing. Many people have what I find, so many people in the autopsy, nothing happens, you don't die of it. But the day this ruptures, we did it the other day, pneumothorax. Pneumothorax can kill you if you don't treat in time, very easy to treat. Put a needle there, the whole air comes out. Anyhow, then I saw some autopsies and all that. That in the brain these vessels, I mean, small. They didn't die of it. It was found incident. Some of you can be having, I can be having, I don't know. I may not die due to this. But the day this ruptures, due to severe hypertension or without hypertension, you can die, you can get paralyzed. Dangerous. Similarly, in the liver, you get SOL. SOL means space occupying lesion. And if this space occupying lesion is a vascular lesion like this, like in this person, very dangerous. Very dangerous means the liver is itself vascular, full of blood. And in that you find a vascular lesion full of blood. So if by olden days we used to do liver biopsy, very often liver biopsy is the most dangerous biopsy in the body, I'm telling you. If you do a liver biopsy of this man, he'll die on the spot of bleeding. I had this lady, 52 years old, very rich lady, Pedder Road in Jasov Hospital. And by the time sonography came, this came, they found SOL in the liver. SOL in the liver, so then ultimately they said it's not cancer, it's not this. Alkaline phosphatase was normal. The only space occupying lesion where alkaline phosphatase normally is this. Anyhow, they could not diagnose. They said, maybe you'll need a biopsy, but it's supposed to be benign. Then she came to me. I told her, madam, most likely it's a vascular thing. Don't try biopsy, you will die on the table. In spite of that, she went to Tata Cancer Hospital, big hospital. I'll get a biopsy done there. In the operation theatre, biopsy was done, operation theatre. She bled and she died. These are the things to be left alone. Nothing. It will not damage your liver. There is nothing to do. It is like a mole. Leave it, no. But this is called as hemangioma of the liver. This is, your liver is supposed to be like that, red. What is this? What happened to your liver? This looks like a butter. Cheese. You know, I eat cheese. I'm very fond of cheese and salted butter. And then cheese, when I put my finger on the cheese, smooth. It just falls down like that. In this liver, and this fellow died of an accident, motorcycle, another fellow, this is a coroner's case. And he was having this liver. Or he must be alcoholic. It's possible. Alcohol, naturally, fatty liver is mainly alcohol, then non-alcoholic. Junk. I'm talking about him as a junk because he was motorcycle people, eating a lot. The red liver becomes yellow and full of fat. So even you put your finger, it will go down. What do you expect? This liver will one day go into cirrhosis. And from cirrhosis, some of the people will develop cancer. This is fatty liver disease. If there is a cyst on the laparoscope, you can aspirate the cyst. I was involved with nuclear medicine in JJ Hospital. I started the department and I got fond of nuclear medicine. So I used to do in Jasrao Hospital liver scan, nuclear scan. So it's just to tell you that we have got now so many methods of imaging liver. When you said liver testing, you're testing the blood only, that's one type of testing. What about the rest? You want to see the liver. Sonography is seeing, CT scan seeing, MRI seeing. This is another method, nuclear. You inject the dye, and when you inject the dye is picked up by reticuloendothelial system. Spleen is also reticuloendothelial. So spleen also will be seen. So fortunately, in my case, I'm interested in the liver, spleen. If spleen is enlarged, cirrhosis. And if there is a space occupying lesion here, then he has got a hepatoma. So I was very impressed. And I still feel in many patients when you can't find out how strong is your liver by albumin and this is another method, you see, because the patient has to pick up the dye. Alcoholic hepatitis, very dangerous disease. I have seen one main case, Shankar Jaikishan of those days, top music director. He was very fond of alcohol, very fond of alcohol. And in the parties we used to meet, I take only a glass of beer and they will offer me more. I said, no, this fellow will drink, and he used to keep his glass in the ankle, on the ankle. And it will not fall. Even if third pack, fourth pack, it will not fall. I was impressed. I said, very good drunkard. Very, very handsome man. This poor fellow was not my patient. But it seems he developed jaundice, pain and jaundice. So they admitted. Those days, we had nothing. No sonography, no CT scan, nothing. So pain and jaundice. Combination means gallbladder, stones. I have often said, the commonest gallstones when you see they must have seen on an X-ray calcified. Usually they cause no trouble. But they can cause cholecystitis and pain and little jaundice can occur. Anyhow, the surgeon wanted to operate. He had deep jaundice. So the GP of his came to me with one or two other doctors and said, "What is your opinion? Do you think we should operate?" I said, "Don't touch him." I said, "This is alcoholic hepatitis. The pain and the jaundice both are due to alcohol. Touch him, he'll die." Of course, there was no imaging. See, I had nothing to support my argument and all that. So they operated. Operation was successful, but he died. Very rare if a patient can get alcoholic hepatitis is not very common. Then we come to ischemic hepatitis. What is ischemic? Due to ischemia in the liver. And this occurs after what is called binge alcoholic. And this binge, sorry. So what is this binge alcoholic? Binge alcohol is becoming very common. Why? Because today the modern generation is working in the room only. They don't go out also. From Monday to Friday night they are on the computer. No walking, no nothing. And hard work, solid hard work they do. So by Saturday, Sunday they want to relax and have a nice drink. 4 bottles of beer, 4 big bottles, 4, 5, because they have not drunk whole week. So that is called binge drinking. So when you have suddenly like this binge drinking, it can cause atrial fibrillation. Atrial fibrillation is something different. We'll talk about it sometime later on. That's very common. That it can. The normal heart is lub dub lub dub lub lub lub. In atrial fibrillation, lub lub dub dub lub lub lub. The heart cannot contract. It cannot send the blood to the liver, kidneys. So they all sort of fail. Kidney creatinine rises, liver bilirubin rises, and heart. You get heart failure. And heart failure, of course, can be diagnosed by the neck veins in the neck. That means the heart failure because heart is not getting enough blood to contract. So and best example is Ranbir Kapoor, one of the finest gentlemen I have met, and he is a very sweet fellow, very nice fellow, because he has come to my lectures in Birla Hall with 1,500 people looking at him. For example, he is diabetic, he developed Bell's palsy. When he developed Bell's palsy, then doctor was not ready to give him prednisone because he is diabetic. So he rang me up. I said, "Keep quiet, just take prednisolone 60 milligram daily for 8 to 10 days. He took it and dramatic improvement because blood sugar will not rise unless you do it for longer, 3 weeks, 4 weeks, larger dose, 100 mg. He recovered so beautifully, and I had called him for my lecture to show. He came. And he is now 70 years old. So now he says, that, "Why should I stop drinking? That's the only thing I'm enjoying. And I've lived 70 already." Good, yes. Every day he must drink. Every day half a bottle of whiskey. But here what happened, he went to London for a wedding of his best friend. So London means there was a damaga, party and all that. Party means what? For 2 days continuously they were drinking. You see, this man, he is now dressed up for the wedding. Look at it in the hand. Continuous. Look at the face swollen. Then he developed swelling and difficulty in breathing. Admitted in the hospital. Lakhs of rupees on the cardiologist. He says, "Your heart is gone." He said, "No, but I had a bypass surgery." He is very jolly. He said, "My heart is strong. Doctor, what are you talking?" Because he found atrial fibrillation, cardiac failure, transient. And anyhow, he's very smart, He changed the doctor. Now liver doctor came. The liver doctor found bilirubin is high, HGPD. He said, "You drink too much, your liver is gone." Again, lakhs of rupees. on that. Then third doctor, he said, kidney. Creatinine had gone to 2.6. So kidneys failed. They went to kidney. So he said, yes, your kidneys have failed. You have diabetes. You have diabetes. You see, you have got diabetes for so many years. Again, he spent lakhs of rupees on third. Ultimately, he got fed up. He took a train, came to Bombay. And when he told me this story, his face was like this. Look at this swelling completely. This is normal. So I told him, you have nothing. Your liver is normal, your heart is normal, your kidneys are normal. Believe me, creatinine had become normal. It was your binge drinking which caused atrial fibrillation, which caused cardiac failure. So the doctor was right. That time you had something, and which caused bilirubin to go high, liver, which caused kidneys, creatinine to go high. They are all normal. So binge drinking, you must learn, is becoming very common, and which causes, in olden days, people were afraid of cirrhosis because of alcohol. Now NASH and then cirrhosis is all because of junk food. So when you get cirrhosis, you get this nodule. See, cirrhosis means this go on multiplying, they go on proliferating liver cells, and some liver cells become like terrorists. So cancer will develop in that, not here, only here. Fortunately now alpha fetoprotein can diagnose, and you treatment has become easy. Today these doctors are putting a catheter, and they go right in this nodule and put cytotoxic drugs. The other people who have got ultrasonic machine, they will go there and burn the cancer. Treatment has become also very easy, or hepatectomy partial. Today the liver cancer has become very common abroad, and they say that the cause is what? Junk food again, cirrhosis developing from there. And so last slide I am showing you is that as a GP, what will you learn? What can you do to help these people? If they don't stop drinking, what can you do? So many chronic illnesses, silent, yes, may be diagnosed. But if you have got routine HbS Ag positive, then I told you how to manage that patient. So that HbS Ag is a very good test for health checkup, liver checkup. If anti-HCV is positive, do a PCR. If that PCR is positive, then of course he needs drugs for hepatitis C. If anti-HbS of your patient is negative, please give him hepatitis B vaccine. If anti-HIV IgG is negative, please give him hepatitis A vaccine, especially when they have got fatty liver and they are eating all that rubbish and they develop non-alcoholic fatty liver disease, non-alcoholic steatohepatitis. We are saying non-alcoholic liver disease, all because of junk food. Thank you.